the best method of treatment, there are not very many good treatments. There are some relatives of cytotoxic chemotherapy, which have been shown to provide some survival benefit for patients with MDS, but by and large, most of them, with the exception of a couple of specific subtypes, most of them are irrevocably progressive to eventual either bone marrow failure or transformation to acute myeloid leukemia. The theory behind this is that over time, either through the process of naturally aging or through the accumulation of some sort of environmental damage, there is a gradual accumulation of genetic damage in the hematopoietic cells, not otherwise specified. And this genetic damage basically leads the cells to become ineffective in their ability to do what they're supposed to do. The problem is we don't know which ones will progress and which ones won't at this point, so we end up treating everyone. But that's a situation where there's a high likelihood of lots of what would turn out to be unnecessary treatment being administered to people. And a lot of that's going to have negative consequences down the road. No clear underlying reason for this to happen. There's no nutritional disorder, no clear-cut malignancy or other problem that would cause this. And a bone marrow biopsy of these individuals would paradoxically actually usually have increased cellularity. So that indicated that for whatever reason the bone marrow was making plenty of blood cells, they just weren't working properly, they weren't getting released into circulation. I don't know where in the fine print MDS is. It's definitely a known recognized complication of giving people chemotherapy, certain types of chemotherapy in particular. And so I have no doubt that it exists in like I said, the fine print of prescribing these drugs for patients.